Hi, this is Dr. Chad Woolner with Acromion Chiropractic. What I wanted to share with you today is a little bit about shoulder problems. Shoulder problems are really common, and unfortunately a lot of people aren't aware that chiropractors can really help with shoulder problems. I've treated a lot of patients who have had shoulder issues and get great results from doing some really simple things that make a lot of sense biomechanically. And so what I'm just going to do is go over some real basic things about shoulder problems. Hopefully this can kind of give you a better understanding and maybe help you out a bit. So what we have here is kind of a diagram of the shoulder, that all the muscles and everything are all peeled away here. What you see here is what's called your scapula or your shoulder blade, and then you've got your arm here. This is your humerus bone. Right up in here is an area where a lot of patients will have problems with their shoulder. Okay, you've probably heard the term impingement syndrome before, and essentially what's happening with impingement is you've got kind of like this little tunnel in here where you've got a lot of nerves, blood vessels, and tendons that travel through this area. So it's kind of a critical area there. What tends to happen, unfortunately, is this humerus, your arm here, can have a tendency to get pulled up into this area and irritate a lot of those tendons and nerves and blood vessels in there. And it kind of does this repetitively. It kind of gets pulled up and banged into that area and kind of causes a lot of irritation on those. You get inflammation there and you get shoulder pain. A lot of times they will refer to bursitis, which essentially is similar in nature. You have what's called a bursa there. That bursa is kind of a sac that acts like kind of like a cushion, and that in itself can get irritated. A lot of times impingement and bursitis, there's a lot of gray area there, but essentially it's the same kind of cause of the problem. You get irritation of that shoulder in there, that bone is getting pushed up or dragged up, and primarily that's a result of a biomechanical problem and a muscle dysfunction problem. Your deltoid muscle, which is this muscle right here on the shoulder, travels over the top there. And what tends to happen, one of the primary problems with impingement is that deltoid muscle overcompensates for a lot of the other muscles. That deltoid muscle, its primary movement is to elevate the arm like this. But unfortunately what happens as well is, in addition to bringing the arm up like this, it will also pull that humerus up into that area and cause a lot of irritation in conjunction with this movement here. So the key really to fixing this issue here is making sure that you have enough stability for this humerus here so that it doesn't get pulled up or translated up is kind of what they talk about here. So let me just kind of show you some muscles here that are really key in this picture. And let me go and rotate this around a little bit. So as you see from the back here, now we're looking at the back of the shoulder blade here. This muscle that travels right up here is called your supraspinatus muscle. This is one of your rotator cuff muscles, and it's really vital for shoulder stability. Okay? Just below it you have your infraspinatus muscle and your teres minor muscle. Those are also part of the rotator cuff, and those also play a really crucial role in helping to stabilize that humerus in place. Okay? And so essentially what's happening when you have this impingement, you kind of notice how these travel around. Let me get a better angle here. These kind of travel under that tunnel here, and you notice how they almost act like a belt on that humerus to help cinch it up and keep it firm and snug in there, keep that stable, to keep it from pulling upwards and jamming into that area up in there. Okay? This right here is called your Acromion Process. It's part of the scapula. Okay? And right underneath there is kind of like this shelf. That's what we're talking about, that spacing there. Okay? So these travel underneath and they help to stabilize that humerus. Okay? So one of the most common approaches that we use to really fix a lot of these shoulder problems is we help to re-engage these rotator cuff muscles and help them to stabilize that shoulder. Okay? Because what's happened essentially here is you've got an imbalance that's going on. That deltoid muscle is overpowering and overcompensating for these rotator cuff muscles. And so it's a really simple approach. What we do is a series of different therapeutic exercises to help kind of wake these muscles up a little bit, re-facilitate them and help them engage to stabilize that shoulder. In addition to that, we also as chiropractors look at the biomechanics of the surrounding areas. If you look here, let me kind of put this back here. This is where the thoracic spine would be, that mid-back, and then the neck is right up here, the cervical spine. The shoulder plays an intricate role along with the spine. It's very interconnected, and then you have your ribs that kind of travel through here. And so as chiropractors, we have a unique role that we play because we look at the entirety of this whole structure together. And so in addition to kind of addressing this area here, we also look at the mid-back and the neck and see how that's being affected as well. And a lot of times it is effective, and so it is affected, and so we kind of address those areas as well. And so typically our treatment plan would consist of a very wide range of therapies that we would approach. We use a lot of different tools at our disposal to help this. We don't just use one type of approach. We will definitely utilize chiropractic adjusting and chiropractic care to help, but in addition to this, we also utilize those therapeutic exercises and rehabilitation, hence the name in our clinic, Align Chiropractic and Rehabilitation. We also focus a lot on that area as well because that plays a really critical role in helping our patients get better. Studies have shown and been validated time and time again that the best approaches for patient outcomes are approaches that utilize a variety of treatment options, not just chiropractic care, not just physical therapy, but a combination of those approaches. And that's one of the nice things that we utilize at our clinic is a combined approach towards treating a lot of these really common problems. So if you have problems with your shoulder or know someone that does, let us know. We'd love to be able to help. For those who watch this video, I will offer to you an opportunity to come into our clinic for a free consultation and initial comprehensive examination. There's some simple things that we can do to evaluate your shoulder. We'd love to be able to help however we can. Thanks for watching the video. Again, if you have any questions, call our clinic. Our number is 208-639-1397. We look forward to hearing from you. We look forward to helping you. Thanks.